Hi, I'm Tom Lynch, Two Things. Today I'm delighted to be joined by Dr. Jeff Ecker, Dr. Laura Riley from the OBGYN department. Guys, the Olympics start in about 6 weeks. We're worried about Zika. We're also worried about Zika in the United States. Laura, tell us a little bit about Zika as a virus and what is the concern with women who are pregnant?
So the Zika virus is transmitted by the mosquitoes. You can only get it from the mosquitoes, so I think people are a little worried.
So it's not sexually transmitted?
It could be sexually transmitted. That's probably a little bit more rare than being bitten by the mosquito. So for pregnant women, the concern is that if you are bitten and you get infected, you could also infect your baby, and the infection in the baby could lead to serious neurologic complications like microcephaly.
And so, Jeff, are we screening all pregnant women for presence of infection with the Zika virus?
No, we're screening everyone for travel to identify those that are at risk, either because they were living in an area where Zika transmission is active or because they visited there. And those women get screening. If they have symptoms, they get screening by PCR to look for evidence of the virus. If they're further out from that, we use IgM to detect if they've been infected.
And Laura, what are the criteria you look at for deciding who is high risk?
So the high-risk person, as Jeff said, is the person who's been to one of those Zika-affected
What are the Zika-affected countries?
So if you've been to Brazil, if you've been to the Dominican Republic, Puerto Rico, so it's really important to sort of know the travel history, to ask patients what their travel history is, as well as the travel history of their partners.
Other partners as well. And what about the southern part of the United States? Is that at risk?
It is at risk, but currently not an area of infection. So the CDC and others anticipate that there will be infections there for many reasons, probably not as prevalent as in South and Central America. Things like air conditioning, screens, less standing water make it less likely that it's going to be to the degree it's been seen in other places. But currently, the only portions of the United States where an infection is a risk are the Virgin Islands and Puerto Rico. And so that's important to remember. Best way to avoid Zika is to avoid exposure. So that means if you can and are planning to be pregnant, avoid travel to areas where infection is active. If you live there or have to be in those areas, bug spray, long sleeves, indoors, all things that avoid exposure. And then of course a fundamental measure that folks can take is when it's appropriate, delaying pregnancy by using appropriate contraception.
And Laura, what about men? We've talked all about women, but what about men who plan to have children? Should they watch Zika as well?
Yes, they definitely should watch Zika. They should try and avoid travel to those places. But if they can't avoid travel to those places, they should then try to avoid getting someone pregnant, use condoms, and if their wives are already pregnant, they should use condoms for the rest of pregnancy as well to prevent exposure.
And I guess for both of you, is this something that as the summer moves on and obviously mosquitoes become more prevalent in both the southern United States and really even up in areas like Boston, do we have anything to worry about north of here, or do you think this will be an epidemic that's pretty much limited to people who travel to infected areas?
I'm sure hoping that it is limited to people who travel to those affected areas, but we do know that the mosquito that carries Zika virus has been found in our area and in other areas of southern U.S. So it's something that I think, luckily, the Department of Public Health is definitely keeping a close eye on. And as soon as there's any question that there are infected mosquitoes, all bets are off as far as we will be full court press.
So Laura, Jeff, thank you so much for your leadership in these efforts and for keeping our patients as safe as we can. I'm Tom Lynch, and that's Two Things.